our world is not prepared for large outbreaks, especially that cross international borders.
What we thought we knew about pandemics, economics, equity, affordable design, global pandemic preparedness has been turned upside down. Switchpoint and the team at IntraHealth International have asked experts from around the world, including me, to look back at their own words and warnings from their past Switchpoint stage talks, particularly talks on epidemics and pandemics over the past years.
Today, we live in an anthropogenic world with increasing drivers of disease. It is no longer a world of infectious disease versus non-infectious disease. We need to ensure that we adopt a multi-sectoral and integrated approach towards disease prevention, risk reduction, detection, and response. All of this is critical.
We need to be coming to the table with different messages, different ways of talking about old things to new people.
You can't simulate pain. You need to feel the pain to be able to intervene appropriately. And while we appreciate every effort that is coming in from the West, I believe very strongly that Africans, locals, should be encouraged and empowered to make changes and to make innovations that will be locally appropriate and usable in their communities.
We may not be as lucky as we were with this pandemic, and I hate to be the doomsday prophet, but this definitely isn't the last one.
We do need each other. It is important to physically connect with other people, the people that you care. And while we don't have the chance, don't have the possibility to do so, this feeling becomes stronger and stronger.
You need creative thinking in those spaces. In fact, it's one of the areas where being creative and having a mind that thinks outside the box adds the most value, because that type of thinking can actually save lives. And I learned that through Switchpoint.
And the reality is, if we're being responsible, we're not thinking in terms of winners and losers across global health. If one of us loses, we all lose.
Were they right about what was to come? Could any of us have imagined the science, the politics, the behaviors that led up to this very moment?
There just hasn't been as critical a time as now to really show up in the ways that we can, that we must in global health and in public health.
Health workers save lives. When we invest in them, we invest in our future. And that's the future we all want.
And what I'm asking of all of you is to make sure we all, together, don't do the easy thing, but do the thing that's worth it.